start with learning about ADHD in order to make careful and worthwhile assessment. There is not one symptom making the diagnosis. And what's also very important is that these symptoms have to be lifelong. So they start early in childhood and they continue into adulthood and even into old age, as we now know from studies. So it's not a temporary problem. It's very important that it has been there always. It's inattention, impulsivity, hyperactivity, mood swings, anger outbursts. These 5 are the main symptoms of ADHD. Very important when diagnosing or considering ADHD that you have knowledge of the comorbid conditions that come with ADHD very frequently, because the mean number of comorbid conditions like depression and addiction and anxiety is 3. So adult patients usually have other disorders that you need to differentiate from, like depression, anxiety, addiction, sleep problems, personality problems, bipolar disorder and autism. So it's really a job for a psychiatrist who has the expertise, or a psychologist with expertise in the field, to make a real diagnosis. We ask the patient and the spouse, and if possible the parents, to comment on the symptoms, first in childhood and in adulthood. This has to be a continuous pattern. You need to have sufficient symptoms, so not a little bit or a tiny bit of symptoms, but you need 6 of 9 inattentive symptoms and 6 of 9 hyperactive and impulsive symptoms, both in childhood. And in adulthood, these symptoms haven't gone away. They can be a little bit less, so from a cutoff of 4 or 5 symptoms, we still speak about current ADHD. But ADHD, this is what I said before, is very important. It starts in childhood, it never goes away, and it's still prevalent in adulthood. This is the typical course of the disorder, and if it starts later or it hasn't got all the implications and all the symptoms required, it might be another diagnosis. It's important not only to have symptoms but also to have impairment in several areas of daily life, so school, leisure time, friendships, relationships, self-esteem is also very important. So we need to assess all those domains with the patient, but also with his family members. We currently use the DIVA 2.0. It's a semi-structured interview developed by my team in The Hague in the Netherlands. And it handles the DSM-4 criteria for ADHD, both in childhood and adulthood. And it assesses impairment in 5 areas of function.